Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Hi, thanks for taking my call. So a few weeks ago, you had suggested that I do some deep tissue work on my neck and inside my mouth, and I have had about at least five or six sessions since then. And I don't really have it. Yeah, as you said, it's very painful when you go deep, very, very painful. But I have no pain, absolutely none afterwards from it.
Good.
So I know we're probably hitting the right spots and doing it the right way. But what I have experienced from, I assume it's the neck work, is that now when I walk, and ever since I started this program almost 8 months ago through your program, when I walk, I move my head left and look to the right all the time. I would go almost a mile and do that, and never had a problem with that. I mean, my vision was still reworking. That helped. But since I've had this neck therapy, now when I move my head left to right, I wouldn't call it dizzy. I am moving to the left. Now I'm moving to, my whole body is shifting. The imbalance is extreme. It's like I'm drunk. That's what I just feel like my whole body I can't walk straight when I'm moving my head left and right. So I don't know. I have taken a little bit of a break from it. I am going to Plasticity next Friday. I'm not sure whether you're familiar with them. They're in Orlando and doing a 2-hour evaluation. They work mainly with brain injury. And so I'm just trying to figure out what are the next steps. Should I, as I've heard, we're going to have these changes. Obviously, the neck work is probably changing the balance in my head. But what should I be? I don't know really what the next steps should be going forward.
Well, I'm going to share my screen again. So I'm guessing what you're talking about is manual therapy.
Yes.
Yeah.
And it's deep tissue work.
Okay, good. Now, what that's going to do, right? Because the sensors in the muscles of your neck, so the richest area of sensors in your muscles and joints is in your fingers, right? That's why we have such good tactile sensory input from our hands and our fingers. The next highest is in our neck. So our neck tells us a lot about where we are in space, and the sensors pick up tension in muscles. And so what happens is over the years, there's been certain tension that has developed in your neck. And that has told your brain how to calibrate your vestibular system and your visual system. So everything's kind of working together. These three systems are constantly communicating with each other so that we know where we are in space. Now what happens is when you go in and release muscles, now the tension in those muscles changes. So now your brain's trying to calibrate different input from the neck with the visual and vestibular system. So things are going to feel a bit off until that calibration kind of comes into effect. One way to improve that is now that you're getting manual therapy and you're starting to realize that, okay, some of those symptoms are going down and it's having an effect. Okay, now we should probably start ramping up our proprioceptive rehab, which is kind of what you're doing, where you're turning your head side to side, focus on a target, turn your head side to side slowly like this, and then up and down like this, just back and forth, because that activates the cervical ocular reflex. So that's neck to eyes, okay? So if we just work on those kind of slow head turns, or there's one where you get a laser headlamp and you focus on a target, and then you close your eyes, you turn your head all the way to the right, and then you come back to middle, try to feel where midline is for you, and then open your eyes and see, is the laser close to the center, right? If not, is it above? Is it below? Is it side to side? And then you can kind of readjust, say, put it there again, put it right on the bullseye, close your eyes, turn your head to the right, come back. Okay, now I feel like I'm in neutral. Open my eyes. Okay, am I getting closer? So what you're trying to do there is help your the sensors in your neck to, be um, more accurate in telling your brain where you are in space. Because then that starts to improve that starts to kind of groove things together, right? So it's almost like you've given yourself a new neck. Now it's time to train it to know where it is in space and help your brain to calibrate with your eyes and your vestibular system. And then the next step on that, like I said, is starting to kind of strengthen things so that you are able to kind of keep it there, right? So that's kind of the order of things. So you're doing this, you've gotten yourself a new neck. Now it's time to learn how to use it.
Yes, yes, and I was doing months of vestibular therapy before I started doing the deep neck, um, but I stopped doing the vestibular therapy, just because I just can't do everything all at the same time. Uh, do I need to go back to them to do that work? I mean, I kind of felt like I had kind of had hit an impasse with them because my neck has now shifted. You know, I I never had really neck pain before we started this therapy. I don't have neck pain now, but the brain signals aren't are relearning, right? As you just said. So should I be coupling? Should I continue the deep tissue? Should I restart the rehab? And should I just stay focused on some simple eye movement on my own?
What you can do as like a first step is go back into kind of the VOMS module that's in the program. Take yourself through that self assessment and see which areas come up for you. And then there's some specific exercises you can do on your own based on what areas are problematic. So that's an easy starting point. But if that doesn't help you after, 3 to 4 weeks, then you may want to consider revisiting either like a concussion provider, or you'll probably learn some things at plasticity that are going to kind of tip you off to some things. Um, they tend to really over focalize on vestibular and ocular motor, though. They tend to kind of not really pay much attention to the neck, even though I think it's a huge mistake. But um, it'll be interesting to see what they suggest and what they recommend and what they come up with. Um, but yeah, like a simple starting point would be to kind of do that VOM self-assessment, figure out what areas are the most problematic for you, and then do those rehab exercises, continue with the soft tissue work that you're doing. And then if in like 3 to 4 weeks you're still noticing that that's not improving, right? If it's improving, then you just keep with it. If it's not really improving, then it may be worth getting either an ocular motor assessment from a vision therapy like neurooptometry person, or vestibular, or even just like a general like MSK physio or PT that can do stabilization and proprioceptive neck retraining exercises.
Okay. Well, that's a lot of data, so I'll have a hard time remembering all that, but I appreciate you sharing.
Okay,
I'll take it
step
one step.
step one,
Yeah.
keep doing
Step
what you're
1.
doing with neck, but go to the VOMS module in the program and figure out what those issues are. There's like a self-assessment in there, and then there's also the exercises that correspond with those issues. So then you can start doing those, right? Give it three to
Yeah,
four
and those were
weeks.
pretty simple. I went through all those at the very beginning, um, but now everything's shifted. Yeah, everything's shifted with it.
Yeah, go back, because when things shift, there's different things that come up, right? It's all kind of layered.
Right.
Um, and that's my recommendation for everyone in this program, right? For those that have gotten to the end and are now like, oh, I'm still having some issues. The recommendation always is go back to the start and just start over, because there's things that you probably have missed. There's things you've probably let lapse as you've gone through, and there's probably things you're going to pick up the second time you go through it. So just go back to the start and then do it again, because you're looking at it from a whole new lens. Issues have changed and shifted. So now you're going to unlock a whole new set of things, and that's just going to peel back another layer. And then if you get to the end again and you're still not quite there, go right back to the start and start over again, because you're going to just pick things up every time you do it. things that you've kind of let go, things that you may not have implemented fully the first go. So you just give it another go, and it's going to just peel things off again. And that's the process. Just back to the start, work through it again.
Yeah,
Yes.
there's different layers of that, this like readiness to learn certain aspects of the program, and it comes in different chapters of your recovery journey. So when we say kind of go back to the beginning, it means that you've kind of moved yourself into a different area of your recovery. So you're going to glean new things from the program as you go through. You might have more of a readiness to sort of absorb different material, different invitations that are within the program. So, we always recommend that. I know it can be a time commitment to go back through, but I think everyone here is committed to recovering as optimally as possible. And so the information that we need to do that is within the program, and each stage of our recovery is going to come with new capacity to absorb different types of information.
Yeah, I remember this one. This was like a couple months ago. Somebody commented in the news feed, and they got to the end, and they were like, "Hey, I still symptomatic, not sure what to do." And I sent them back to the start, and then they went into your module, Melinda, and started actually implementing all those things because they're like, "Yeah, the first time I went through it, I kind of like just breezed through that." And they're like, "But when I actually went back and did it and like said, okay, I'm gonna actually do this," they were like, that unlocked everything. And then that's what got rid of the rest of their symptoms. So it's something that, it's good to go back and just revisit. And I just can't
Yeah.
emphasize that enough.
It's a readiness thing, right? So, for example, that individual that went through the program might have come into the program with a specific focus, right? My neck's bothering me. So they might have just really kind of went through the program with blinders on until they got to the next section. Then
Mhm.
they focused on that. They get to the end of the program. They realize there's still symptoms. Oh, what's wrong? Why am I not better? I did the neck piece. Okay, let's go back. Right. And then there's more of a willingness and more of a readiness to sort of open their eyes to different invitations that they can find in the program. I always use the word invitations when it comes to psychological things because it's different for everyone. And it might be more recommendations when it comes to Dr. Paul and Dr. Cam's sections. But, there's just different stages of our recovery. And each stage is going to come with a readiness and a willingness to try new things and different things and be open to it. So that's where that recommendation comes from.
Thank you.
Hopefully that helps. Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.